The monkeypox outbreak is now a public health emergency in the United States. That means the government will free up more money and other resources to increase testing, treatment, and vaccine production. The virus has infected almost 9,000 Americans, but how did we get here? And what's next for you at home? I'm Ben Briscoe. We're digging into the monkeypox outbreak and answering your questions to give you the context behind the headlines. The CDC says monkeypox was discovered in 1958 when there was an outbreak of a pox-like disease in monkeys kept for research. Despite its name, researchers say the source of the disease is still unknown. But they say rodents and non-human primates like monkeys can harbor the virus and infect people. The World Health Organization says the first human case of monkeypox was found in the Democratic Republic of the Congo in 1970. Since then, most cases have been reported from rural rainforest regions of the Congo Basin. This, by the way, is not the United States' first outbreak of monkeypox. In 2003, the CDC says there were 47 confirmed and probable cases of monkeypox across 6 states. They traced the outbreak back to pet prairie dogs that were housed near imported small mammals from Ghana. It was the first time that human monkeypox was reported outside of Africa. But how did we get to today, where monkeypox is spreading to thousands in the US? The first case this year was identified on May 18th in Massachusetts. State health officials said the case was in a man who recently traveled to Canada, but he did not have a travel history to areas with high levels of monkeypox. At this point, monkeypox cases have been identified in all 50 states. So far, the majority of cases in the U.S. have been seen in men who have sex with men. But state and federal health officials say anyone can get it. In fact, they're reporting at least 4 confirmed cases in children. Listen to this. Recently, a daycare worker outside of Chicago tested positive. Health officials say some children at the daycare were exposed to the virus, but they don't know exactly how many. In that case, the FDA approved use of the monkeypox shot for kids under 18. But as we get closer to the school year, some parents are wondering if their child can get the shot just to be safe. Casey Decker verifies.
More than 5,000 people in the United States have gotten monkeypox, but almost none of them have been children. There are vaccines, but as viral posts have pointed out, health departments are severely limiting who they'll give them out to. And while there is no evidence yet to suggest the current outbreak in the U.S. is more severe in children, some other posts say that has historically been the case with past outbreaks of the disease. So with the first American cases in kids confirmed in recent weeks and the school year on the way, some parents are wondering if there are protective measures they can take. So let's verify. Are children eligible for the monkeypox vaccine? Our sources, the CDC, several major city and state health departments, and Allison Messina, the chief of the Infectious Diseases Division at Johns Hopkins All Children's Hospital. There are currently 2 monkeypox vaccines available in the U.S., but there isn't a lot of supply of either, and so local health departments are only giving it to those most at risk. Right now, that means men who have sex with men, since they make up the bulk of cases so far. And even within that group, it can be difficult to get the shot as a preventative measure. With few exceptions, health departments are only giving it to people who have been directly exposed to the virus. But if you have been exposed, no matter who you are, you could be eligible for the shot, and that includes children. The CDC told Verify, quote, "Children and adolescents with exposure to people with suspected or confirmed monkeypox may be eligible for post-exposure vaccination." Dr. Allison Messina says the current eligibility requirements make sense, given that the disease is so far spreading mostly within specific adult groups.
Right now, there's not a big push to provide routine vaccinations for monkeypox for children. Now, that may change if it continues to spread.
So we can verify no, children are not currently eligible for the monkeypox vaccine unless they have been directly exposed to the virus. And right now, one of the 2 vaccines is FDA approved only for adults.
So parents, do you need to worry about monkeypox? Here's what the former FDA commissioner has to say.
I don't think this is something that people need to be generally worried about. I think that probably the incidence of this infection in the broader community is still very low. So your risk of coming into contact with monkeypox is exceedingly low outside of certain social networks where you see a higher case rate.
Health experts say that everyone exposed to someone who has a confirmed case of monkeypox should definitely get the vaccine. But do we have enough supply for all of that? Well, both the Guilford County and Forsyth County health departments have an allotment of the vaccine from the federal government. That means they receive new shipments of the shot every once in a while, but appointments are filling up fast, typically right after the health department gets their new doses.
What we didn't have right off the bat, which likely we should have, would have been enough mobilizable vaccine to get it to everybody who needs it purely because they're at risk, not because they have a documented exposure.
But if you are in one of the high-risk categories or have had a known exposure to monkeypox, reach out to either the Guilford or Forsyth County health departments. They can point you in the right direction to get a shot. There is no official cure for monkeypox, but health experts want to reassure everyone it is treatable.
We have a vaccine and we have therapies that we developed originally against smallpox, since this virus very much is in the category of smallpox, although it is much less severe. So the real challenge now is to expeditiously get those interventions to the people who need them.
Just like this guy right here. The main message is that the vast majority of people recover from monkeypox. Take Wesley Wallace, for example. He caught monkeypox over 4th of July weekend. You've heard from him before right here.
As you can see, from the time it started, it's just progressed and gotten worse and worse.
Well, I want you to take a look at him now. He is healing up. A few scars may remain from the pox on his face, but he is ready to move forward.
So excited because it's going to make me feel, human again. I'm hoping my face will look back to normal, hopefully in a couple of weeks. See.
Monkeypox is something most people survive, the vast majority.